San Diegans being advised to mask up once again. The guideline changes here and across the country, and Pfizer's latest finding that could help slow the spread of the coronavirus. A multi-million-dollar debacle in the wake of new revelations about the 101 Ash Street purchase. The city is looking into other real estate deals it made around San Diego and if there were any more missteps. An Olympian with local roots celebrating big today. Her inspiring and dominating gold medal win. ABC 10 News at 11 starts now.
ABC 10 News at 11 starts now.
So glad you could join us. I'm Virginia Cha. This morning, we're waiting to see what else develops on the heels of the announcement from the CDC adjusting their mask guidelines. San Diego falls into the category the agency has laid out in which transmission rates are high enough, the red category there, that people are being advised to wear masks indoors in public, regardless of vaccination status.
Right now, unfortunately, the disease is hitting the people who are unvaccinated. And from there, it's coming back to hit the people who are vaccinated.
The county is echoing the CDC recommendation, though not mandating anything yet. We're waiting to see how the state responds further. New York this morning adopting measures for state workers similar to California, and Nevada adopting a mask mandate based on those CDC recommendations. All of this coming as Pfizer boasts some new data that they say could help us take on the Delta variant. ABC's Rena Roy has the details.
Back to masks across much of America, the CDC reversing its guidance, now recommending everyone, including the fully vaccinated, wear face coverings indoors in areas hit hard by COVID and in schools. CDC Director Dr. Rochelle Walensky says new science shows even some vaccinated people can spread the Delta variant.
We felt it was important for the vaccinated people to understand that if they happen to be one of those breakthrough infections, which was more likely in areas with a huge amount of transmission and disease, that those people could potentially pass it on to somebody, a loved one who was immunosuppressed.
The data showing, though, that the vaccine reduces the risk of getting the virus 7-fold and the risk of being hospitalized 20-fold. Dr. Fauci urging people to get their shots on CNN.
To save your life, to prevent you from being hospitalized, prevent you from dying.
Right now, more than 63% of counties across the U.S. are seeing a surge.
We are all at risk. There are many who wanted to declare victory over this pandemic several months ago, but it's far from over.
The CEO of Pfizer saying booster shots may be necessary, with some studies suggesting the Delta variant challenges the vaccine's protection after 6 months. He spoke with former White House advisor Andy Slavitt in a podcast.
We can see that there is a drop in the protection of infections, and there is a drop in the protection against hospitalizations, but only for people, or mainly for people, that they are 6 months, that they did 6 months ago their second dose.
Rena Roy, ABC News, New York.
A huge looming question has been how private companies will react to the CDC recommendation. Well, now we are learning one of the biggest employers in the country is making a move. Google says they are delaying the return to work from September 1st to mid-October and will require employees be vaccinated when they come back. Those who cannot or won't get vaccinated will continue to work from home. Now, as the U.S. weighs these new mandates, a restriction is being lifted for American travelers. Fully vaccinated people from the U.S. and EU could soon visit England again without quarantining when they arrive. England's Prime Minister Boris Johnson making that announcement and said a meeting on the topic will be held later today. That's coming just 2 days after London's Heathrow Airport urged the UK government to open up the country to some vaccinated travelers. As you can see, the situation is evolving. A lot of new developments as governments react as well, and as we learn more about the coronavirus situation in our region and beyond. As we do that, ABC 10 News would like to hear from you. We just launched a poll online asking viewers in the wake of the changed guidelines from the CDC, and as we see cases increase, are you altering your approach? Are your habits changing when you go out in public now or to indoor businesses? Let us know at 10news.com/myvote. We also sent out a link to the poll through our smartphone app. Well, questions have been raised for years about the botched 101 Ash Street deal. Now, other properties that the city acquired in the last few years are coming under scrutiny. ABC 10 News anchor Mary McKenzie joins us live now. Mary, it sounds like they have uncovered problems with some other buildings, too.
This independent audit looked at all of the city's major property deals over the last few years, finding a serious lack of policies and oversight. Now, as you said, for years we've covered this taxpayer-funded debacle here that is 101 Ash Street. This audit, though, looked at 4 additional buildings.
We have wasted millions of taxpayer dollars, and we're stuck with an uninhabitable building at 101 Ash Street, overpaid for the navigation center, and can't use the Kearney Mesa repair facility to repair our fire trucks. Simply put, it wasn't just a lack of due diligence on these properties. In some cases, there was straight up deception on the part of city staff when communicating information to the city council.
This is the first look at the deals on these other city-acquired properties. And the findings of this audit show they're problematic as well, although not nearly on the level of Ash Street. The other buildings are Civic Center Plaza, Kearney Mesa Repair Facility, the Palm Avenue Hotel, and the Housing Navigation Center. All 5 acquisitions combined total more than $230 million. Major problems with the process are being exposed in this audit. It found the Real Estate Assets Department under Mayor Faulkner didn't understand or properly disclose information about the condition of the buildings it was purchasing. It also found the city attorney's office didn't consistently document the legal risks of real estate contracts. It said there were unclear roles and responsibilities, no main decision maker on the deals other than the mayor, and not enough due diligence done on these buildings. The independent auditor said the value of one building, a former indoor skydiving center, was inaccurately inflated. And the audit said the prior administration limited city council's oversight by rushing the timeframes to minimize city council reviews of the acquisitions.
Another city council member called this a real wake-up call, said the city's going to need more time for real estate deals. They might miss out on some good deals, but protecting the taxpayer was more important. We did reach out to Mayor Faulkner's office for comment. We have not heard back yet. The city attorney has already fired back at some of the disclosures from this audit. Reporting live, Mary McKenzie, ABC 10 News.
Thank you, Mary. New today, a local athlete making history at the Tokyo Olympics. Poway native Kelsey Plum is part of the U.S. women's hoops team that won gold today in a brand new event, 3-on-3 basketball. Plum played her prep ball at La Jolla Country Day. She now plays for the WNBA's Las Vegas Aces. This is video of her being drafted. She and 3 other pros capped off an Olympic tear this morning with a win over Russia, completing nearly flawless run, losing only 1 of their 10 games. A big win for Plum, who came back from tearing her Achilles a year ago to win gold this summer. Congratulations. Well, as temperatures go up around here, there is a new focus on keeping San Diegans cool. Members of the County Board of Supervisors going to lay out a plan to help keep residents cool during any upcoming heat waves. We're going to hear more about the plan later today, and we'll have details on later editions of ABC 10 News and on 10news.com. Now, beyond COVID, county officials are looking to tackle other potential health issues in San Diego as well. Today is World Hepatitis Day, and this morning we got an update on the progress made in tackling hepatitis C infections in San Diego County. ABC 10 News reporter Marie Cornell is live near the county admin building. Marie, they also released goals for the coming years.
Yeah, Virginia, so you may remember a few years ago the county was dealing with an outbreak of hepatitis A that killed 20 people. Today, county officials released their plan in dealing with hepatitis C, which is a different virus. Under the Eliminate Hepatitis C initiative, the county has set a goal of reducing the number of new infections of hepatitis C by 80%. They're also working to cut the number of deaths by 65%. All of this by 2030. During a news conference Wednesday morning, county officials, along with private healthcare partners, introduced how they plan to do that. From initiating a robust capacity surveillance, really working within all communities, informing them about what hepatitis C is, to giving them the resources they need to be able to screen for this liver disease.
Health officials say hepatitis C typically goes unnoticed, since most people who get it won't show symptoms until they develop long-term complications. That sometimes occurs within 6 months of exposure. Tara Stamos-Busig, the executive director of the Harm Reduction Coalition of San Diego County, says they've discovered the communities that are heavily impacted by COVID are also impacted by hepatitis C.
We need to get out there and make sure that those communities have access to all the best practices, that they have access to medication, and that they have the ability to be treated with love, kindness, and dignity while also taking care of their health.
Supervisor Nora Vargas says there has been funding set aside to work with all communities, including those who are homeless, to try and stop the spread.
There's additional resources in the last budget to ensure that we are using these models of preventive care, like what they call street health, right? And making sure we are in the communities and supporting the programs that are actually doing that work.
And the biggest difference between hepatitis A and C is that there is no vaccine for hepatitis C. Live outside the county admin building, Marie Cornell, ABC 10 News.
Thank you, Marie.